So today I thought I would talk about a topic dear to my heart, which is flashes and floaters. And as a retinal surgeon, I see a lot of patients complaining of these issues. Flashes and floaters are very common symptoms, and the vast majority of the time they're not an indication of any problem that needs treatment or anything too serious. But the trouble is that occasionally they are. And you can't often tell by just symptoms alone how serious the problem is. So why do people get flashes and floaters? Well, the most common reason for floaters is just having the age-related changes in the jelly of the eye, in the vitreous humour, which happen in all of us. As all of us get older, the jelly gradually liquefies, and this is the ball of jelly that fills our eye. It gradually breaks down. The little protein strands in it start to stick together, and it becomes more mobile inside the eye. And eventually, the whole jelly kind of blob doesn't maintain its shape and collapses and starts to move around inside the eye. And as it does so, the little protein strands in it start to float in front of the retina, and you get these shadows that they cast, which people see as floaters. Now, the process of the separation of the jelly from the back of the eye is called a PVD, a posterior vitreous detachment. This is a natural aging change in all of us. And it happens at some point in your life, but most commonly in your sort of 50s and 60s, could be earlier, could be later. And at that point, people often notice a sudden release of quite a lot of floaters. Now, majority of people, the process of PVD happens. You may or may not notice the increase in floaters. You may notice some flashing lights where the jelly can pull on the retina because it remains attached around the edges of the retina, and as it kind of moves around, it tugs on the retina, which generates light signals. So you might see some flashes, which are typically on the edge of the vision. It's always advisable, if you have got new flashes and floaters that you've noticed, to get checked out by an eye specialist. Because occasionally this process of the jelly detachment can cause some damage. So the jelly can tug on a blood vessel and release some blood and cause a bit of a bleed in the eye, in which case you might see lots of little tiny black dots swirling around like smoke in the vision. Or the jelly can cause tears in the actual retina itself, the wallpaper inside the eye. And if you get a tear in the retina, it's got a reasonable chance of developing into a retinal detachment. Not all of them do, and we do see some tears that have happened before. Perhaps nobody saw the patient, perhaps they didn't have symptoms, and we see tears that haven't caused the problem. But we also see a lot of these tears that cause a retinal detachment because if you have a hole in the retina, a tear in the retina, and it's been kind of pulled up by the jelly, that opens the tear up and it allows the fluid from inside the eye to come underneath the retina, and the retina starts to fall off, to just peel off like wallpaper off a wall. And if you've got a retinal detachment that's picked up, then you usually, not always, but usually do need an operation to fix it. So, very important, new onset of flashes and floaters, and of course any part of the vision being blurry or dark, you always do need to get checked out by an eye specialist.